What's next in global events? Third World War? The Rapture? A revival? The Great Tribulation? The body of Christ has been misinformed and misled for so long by the cunning craftiness of deceitful plotting. Once we understand God's eternal purpose for the earth and humanity, and then his pattern, principles, and plans, we will have an understanding about why things are going the way they are in the world. Enroll today for the next Move of God course from the Kingdom University to find out and prepare for what is coming. With the enrollment, you will receive PDF versions of the 2 latest books by Abraham John, The Birthing of a Kingdom Nation, and What Happened to God. The online course starts on October 17th, 2024. To enroll, please visit www.thekingdomuniversity.org.
Good morning, everybody. Welcome to Mamlakak Broadcast Network, to your next health bulletin. We are working on our cancer series. This is the 3rd episode of the series. And what is so important for us to learn about our health? Because if we don't take care of our health, we won't be able to fulfill the purpose that God has given us for our life. Do you know that when you take care of your body, your mind, and your spirit, and you take care of your health, it's like an act of worship to the Lord and an act of obedience? Worship is not just going Sunday and singing the songs and the psalms and singing. That's not only worship, but everything that you do during the day, every decision that you take, every single time that you decide to say no to a cookie or something that you know that is not good for your health, every single time that you do that, you are worshiping the Lord. Okay? Every single time that you make a right decision, a decision that is aligned with God's will for your life and what He's and the principles that He has in the Bible for the kingdom, you are worshiping the Lord. Okay, so it's very important for us to learn how our body works and what we can do. Now, today we're going to be discussing about holistic versus conventional treatment for cancer. And you said, but why do you want to talk about these topics if we don't have cancer or we don't want to have cancer? Well, the key is that, for God forbid we get cancer, but if we come to that diagnosis, then what we're supposed to do is good to be informed on what to do, so that way you can get the best care. Because when you're not informed and you just go to the doctor and you get that diagnosis and you're paralyzed and don't know what to do or doesn't have any knowledge whatsoever, then you're going to take whatever the doctor give you. And if you get a doctor that like to push drugs and chemo and surgery and things like that without searching deeper in the root cause and everything else, and not looking at the patient as a whole, but they just have a protocol that they just send out to everybody and that's it, then you might not get the best care that you're supposed to get. So knowing a little bit about the treatments and how to make the decision on what treatment to get is a good idea for us to know how to make decisions when it comes to such a diagnosis. Plus, some of the treatments that are given for cancer some of them can be preventive, that we can maybe employ as a preventive care now to prevent getting cancer. So that's why it's good to know what is out there. This particular show is not comprehensive into everything conventional and everything that is out there in the natural world when it comes to the treatment of cancer, but it's give a highlight onto the most common things that are happening now, so that you can have an idea that there's a lot of things there that you can do in order for you to treat the cancer. So let's put our PowerPoint up, please. Okay, so as you can see, we have what is called alternative and complementary medicine, which is the holistic, everything holistic that have to do with your body, your mind, natural, usually no drugs. Is helping your body to optimize the health of the body. So use like his innate healing abilities to kill the cancer. And then we have the conventional, that the conventional is is a drug or major surgery or something like that, just to cut down, kill up, and that's it, the cancer. So that's the two things that we have. So we're going to start discussing the different conventional ones first, and then we're going to go to what we have for the holistic. Let's go to the next slide, please. So the first one, and the one that everybody knows, is chemotherapy. Chemotherapy is a drug treatment. It's a chemical that kills all, that kills all cells. It's not only killing your your cancer cells, but it will kill any cell in your body. When you're taking chemotherapy, the chemotherapy is not targeting the it's not targeting the cancer itself or the tumor only. It's targeting all the cells in your body from the top of the head to the bottom of your feet. So all the cells are getting that damage. Chemo may be given with a curative intent, but most of the time they give it just to prolong your life as much as they can and to reduce symptoms of the cancer. Meaning that it might prolong the life, but the quality of life that you get after having chemo treatments is real bad, because chemo can cause other cancers also as well. The chemo not only kill the cancer cells, they kill also the healthy cells, and some chemo dose can damage the cell's vital organs like the heart cells and the kidney, the bladder, the lungs, and the nervous system. Usually, a lot of people that get chemo, they probably end up with congestive heart failure, or if it's a young woman, they become sterile, that they won't be able to have babies, because their ovaries are not working fine. Some people might end up in kidney disease or kidney failure, and they're going to need to have dialysis. And also chemotherapy, it might kill all the cells, but it still leaves some stem cells running around that can come back again, and then that particular chemo can be resistant to that particular cancer now, and you might need a different chemo in order to treat the new cancer coming up if you get cancer. So chemo really, it's not necessarily the best choice, but sometimes remember, every cancer is different. Every person that have cancer is different. The condition of the body is different. Treatment are chosen depending on your health, or if you have any other comorbidities, other diseases, you have chronic diseases, if you are healthy, if you're eating healthy, if you have any other problems, if you have any allergies, you might not be able to take this chemo or not be able to take this treatment. So all those factors have to do in what kind of treatment. And that might be a case where chemo will be the best. There can be cases where chemo will be the best, but not necessarily always. Okay? So let's go to the next one. Then we have radiation. Radiation is a treatment using ionizing radiation. It's usually targeted to the area only, but let's say, like for example, you see this picture is giving radiation to one of the breasts. But if you can see, the radiation not only going to the breast, it's going a little bit to the under the breast and a little bit over the breast, so it can damage the whole area. Okay, the symptoms on radiation are a lot less than on chemotherapy, because chemotherapy, you get the nausea, the weakness, the fatigue, the lack of appetite, the losing weight, losing your hair. With chemo, with radiation, you might not lose your hair, only in the area where the radiation is happening, and most of the damage happen in the area where the radiation is applied, where you can have skin rashes, a skin burn, damage on the cells all around it. You can have a little bit of nausea and weakness because of the radiation, even though that it's targeting in the area. A little bit of that radiation is flowing into your body, so it's going to give you tiredness and weakness and all that kind of stuff. So also, if the effects are less, but it's still some effects. So radiation treatment has fewer side effects, and radiation can raise the risk of developing a different type of cancer. Factors that can affect is how much radiation you get. So if you are getting a lot of radiation, because the more radiation that you get, even though like that it's targeted to the area, a little bit of the radiation is going to the rest of your cells. So depending on how many treatment of radiation you have, because of the abundance of radiation in your system, you might cause a secondary cancer in your body. So again, radiation can be something good when it's needed, but not necessarily the best thing out there. But when it's needed, it can be something good. Let's go to the next one. We have immunotherapy surgery. Immunotherapy and surgery. It's supposed to be, the surgery word to the other side. But the immunotherapy is a treatment that uses a person's own immune system to fight cancer. Immunotherapy can boost or change how the immune system works, so it can find and attack the cancer. So this is using your immune system to create antibodies that will attack exactly instead of attacking all the cells in your body, will recognize the cancer cells or the tumor, and it will attack directly the cancer cell or the tumor. That's a more targeted therapy, okay, which is a good thing. But the thing is that that the immune system might be able to recognize other areas of your body that are not part of the tumor. If they're similar, it might attack it as well and cause some damage. But it's more targeted that chemo and even more targeted than radiation a little bit. So immunotherapy is better suited for targeting specific cancer cells rather than healthy ones, but it can be slower and very inefficacy. So usually immunotherapy is given at the end of all the treatment when a person is getting chemo or radiation. Then the third thing that they use will be immunotherapy, or somebody that is just in the beginning, the first stage of stage 1 cancer that doesn't have that much, that maybe they can just attack that little bit with the immunotherapy. That might be a good thing that they can do as well. But people that cannot use immunotherapy are people that are immunosuppressed. So if you have HIV, if you have autoimmune disease and you're using a lot of steroids, like which one of the medication? Well, any steroids that you might be using in the chronic, then you won't be able, because it will not work. It will not be able. You have to have a very strong immune system so they can activate it to be able to use immunotherapy. Then the next thing that they have in the conventional is surgery. And surgery can be very good and sometimes, and not so good some other times. Surgery can be very good when it's a primary surgery. Let's say they found a tumor. The tumor is located in one place. Okay, it's not spread any other place. It's located. It's firm there. They can take it out. And sometimes the benefits of surgery is that when they open the patient, they might find that there's other cancers that they will not be able to see in the CT scan or the PET scan, and they'll be able to see it when they open, and they can, since they're there, they can take it all out. And that can be even a cure for somebody when that's all they have and they take it all out. That can be the cure for somebody. But there's always a risk with surgery, okay, that some of the cancer cell can spread. It's very rarely that can happen, but rarely cancer can be spread with surgery. Like if he is not able to remove all the tumor, okay, when they have the opportunity to open, maybe they don't have not able to take all the tumor, or they don't take enough of the healthy around the tumor, so they make sure that they take it all out. It might be a issue with spreading the cancer. Okay, sometimes even when they do the biopsy, because usually when they do the diagnosis, in order for them to do diagnosis, they probably did a CT scan or an MRI where they found something, and then they want to do a biopsy. And sometimes when they do a biopsy, they don't take out the whole cancer, they just take a little bit of the tissue there. And sometimes they said that when they take in a little bit of the tissue there, is it get contact with oxygen, it can spread the cancer, sometimes. So that's another thing that can happen with that. So now we're going more now into the alternative, okay, care treatment, or this is less holistic but more alternative, because even though that it use drugs, is less invasive than regular chemotherapy. But what is insulin potentiation therapy? Insulin potentiation therapy is also known as low dose or fractionated chemotherapy. It uses insulin to make cell membranes more permeable to accept chemotherapy more effectively. The increased responsibility of the patient cells to the chemotherapy allows doctors to use approximately 10 to 15% of the amount of the chemotherapy that traditional oncologists commonly prescribe, thus decreasing the side effects of conventional chemotherapy. So this kind of treatment is usually used by a integrative cancer doctor or naturopath oncologist, that they use this type of therapy because they use the insulin. Remember, insulin take the sugar into the cell, okay? And you know that cancer cells, they're greedy about the sugar. So if they use the insulin, what they do is they put the insulin first, they inject you the insulin first, and then they inject the chemotherapy. That way, the chemotherapy will go directly. They need a lot less, because they need a lot less, then they damage a lot less cells in your body, okay? And the treatment is more targeted. The good thing about this treatment is that when they do this treatment, they do treatment before this treatment to strengthen your healthy cells, okay? Then they put your insulin, then they put that little the chemotherapy that's going to target, and then after that, they do some holistic treatment to reboost your cells again. Okay, so it causing less damage, reducing the amount of side effects and all that stuff. And they have found out that it's working pretty good. But this is relatively new. Okay, it's been out there for more than 10 years, but being publicly that the more people are wanting to do it and more doctors are into it, is relatively new. Okay, the insulin potentiation therapy. While any cancer can technically respond to the IPT, but the ones that respond better are breast cancer, lung cancer, colorectal cancer, lymphoma, prostate cancer, and melanoma. And patients who receive IPT treatment commonly receive a vitamin C IV. Okay, vitamin C IV, that means a high dose of vitamin C. The good thing about vitamin C is that you cannot overdose in vitamin C because your kidneys keep the level. So and vitamin C is a water soluble vitamin, so the kidney keep a level and be the rest of the vitamin C. So what they do usually is they give you the vitamin C because the vitamin C complements the effect of the IPT. Vitamin C has been shown to cause oxidative damage in cancer cells, which is how some classic chemotherapy agents work to kill cancer. What vitamin C does, okay, is cause oxidative damage. But you're probably telling me, but last week when you talk about that, or the week before, you said the oxidative stress caused damage to the cell and that caused the cancer. But the thing is that vitamin C have almost the same molecule as sugar, so the cancer cells will accept it and that will kill the cancer cell. But at the same time, vitamin C is an antioxidant that help the healthy cells stay healthy by cleaning all the free radicals and reducing the oxidative stress on the healthy ones. So this is like a dual. It's helping the healthy cells and it's damaging the cancer cells. So this is a really good treatment when it comes to an alternative treatment when it comes for cancer. And and usually the people that are receiving the IP treatment, they also receive other IV treatments like glutathione and other vitamins, because what they do is try to correct whatever deficiencies they are and give the cells, the good cells, all the good environment that they need to stay strong and resist whatever the little chemotherapy that they're receiving can damage in them. Okay, so that's why this is a very promising type of therapy for cancer. Let's go to the next one. So this is other holistic alternative treatment. We already spoke about the vitamin C. Okay, and right now you can get, they have what they call IV lounges where you can go and get IV vitamins just to make sure that you have, you take care of any deficiencies that you have in your body. So you can even get the vitamin C, the glutathione. The glutathione is a major antioxidant and help protect cells from free radical. Now let me tell you something about this type of treatments. The glutathione, vitamin C, and other vitamin treatments that you can get in as IV and that can help the cells through cancer treatments and stuff like that. You have to be very careful how to take it, and that's why you need to have an integrative oncologist that be the one to tell you when to take it. Because, for example, glutathione is excellent to take it before and after chemotherapy. But during chemotherapy, let's say if somebody decides that they're going to take chemotherapy as well, with the conventional treatment, they want to take the conventional treatment together with integrative treatment, okay, and they take chemotherapy, then glutathione. Then what it does is it's gonna, because it clean up the cells. You want the cells that are bad, the cancer cells, to actually receive all that chemical, so they die. Then it's gonna clean up, and then it's gonna make the chemotherapy less effective. So that's why they need to know which one to use and when to use it. And that's why it's so important that you have an integrative oncologist as well. Then they have another treatments called photodynamic laser therapy. It's typically used with your IPT. The principle is to use light-sensitive drugs, which once in the blood enter the tumor and then are exposed to the PTD, meaning that they give you that chemotherapy, but the chemotherapy is sensitive to the light. So when they put the machine with the light, that way the light attract the chemo to that particular area. It's kind of helping to be more targeting and less invasive, to the rest of the body. And then we have the pulse electromagnetic field therapy. Is used before receiving IV treatments, whether it is vitamin C or EPT. This treatment lasts up to 30 minutes and is designed to re-energize damaged cells and open them to receive the IV treatment. It may be used as a detoxing device and can also reduce the positive effects of exercise for those who are physically unable to exercise. So you see, like I tell you, all the holistic treatment is not only helping you killing the cancer, but it's helping you fight all the different types of side effects that you can have from the conventional treatments. Okay, and it help you to revitalize your body as well. So this is excellent, and they have no side effects. Then you got the Beamer. The Beamer works on a macro circulation geared towards dilating the blood vessels and at the capillary level to declump them to improve absorption of the IV therapies, metabolism, and detoxification. Because remember, the key is be able to take out all the things out. So detoxification is very important. We also have IV ozone. Let me tell you, the IV ozone, the Nanobi therapy, and the Hoka sauna, they all almost the same. The key of those one is to give you more oxygen, to give more oxygen into the cells, because the cancer cells are anaerobic, means that they don't need oxygen to they don't use oxygen, so the oxygen will kill them. So if you give higher oxygen to the body, the good cells are going to get stronger because they're getting the oxygen and be able to make the ATP and the energy, but the bad ones will die. So those are all complementary services that they can give either together with the chemotherapy or by itself, or use it also as a preventive care as well. Okay, so let's go to the next one. You can go to the next slide. Producer, you can go to the next slide. Or let me just go to the next slide. Okay, so we also have nutritional treatments. We have what they have, the alkaline diet, which is based off of vegetable and fruit, create less than optimal environment for cancer, while at the same time strengthening the immune function and supporting healthy cells in the body. It's said that the cancer like to grow in an acidic environment. That's why it's anaerobic. They like to have an acidic environment. So if you got an alkaline environment in your body, then the cancer cannot grow. The good thing is that the most things that you can eat in the alkaline diet are the same. Alkaline and inflammatory diet, they're almost the same thing, are the same fruits and vegetables that are anti-angiogenesis. That means that help kill the cancer. So that's an excellent diet. Another thing that also they use a lot when it comes to the nutritional treatments, when it comes to cancer, is juicing. Why juicing? Because when you're doing juicing, you're taking all the nutrients, you are removing the pulp and the fiber, but you're getting like a concentration of the nutrients, okay, of the plants or the vegetables. So instead of being able to eat one carrot, you're drinking 10 carrots. And that means that you're getting all the antioxidants and all the phytonutrients on 10 carats at once. And because it's liquid, it doesn't give any work to the body, to the digestive system, and the body can absorb a lot more, giving that rest and reserving that energy for the healing process that the body needs to do. Then you have the ketogenic diet. The ketogenic diet is a diet that is low in carbohydrate and high in fat. And what that diets do is that fat is necessary, to help the composure of the cells, and taking away the carbohydrate will lower your insulin, okay, and will lower your insulin resistance, and we will lower inflammation, and all that will help lower the risk of cancer, and also lower the potential of that cancer to grow. So that's another way that they do. They also use fasting because, and let me tell you something, when it comes to fasting, not everybody that's in chemo treatment can have fasting. If you have a situation where you are diabetic also, or maybe you are losing too much weight, vomiting a lot, are very deficient in very nutrients, and fasting is not going to be for you. Okay, but fasting can be a great method for cancer, because early studies show that fasting might protect healthy body cells from chemotherapy, and that it might help chemotherapy to work better on cancer cells. Not to mention that, remember that when you fast, you go to the process of autophagy, that autophagy will help clean up the cells and repair the cells that are broken and things like that. So that's another way that you are also combating the cancer. And remember, there's other things that they do in the holistic world. They do, like I told you, the IV vitamins, dietary supplements, like for example, soursop, for example, the black seed oil, alpha lipoic acid, high dose of vitamin C, your vitamin D3, omega 3, all those supplements, like I talked last week, that are great for fighting cancer. And then they also have botanicals. There's a lot of ayurveda, organics, herbs, and things like that that they also incorporate into your diet to help you with the treatments and the killing of the cancer. And then also there's a Dr. Butwick, is a lady doctor that she have won the Nobel Prize, or she been about to win the Nobel Prize several times, and she created a protocol that also help cancer. It's a combination of flaxseed oil and cottage cheese. She said the sulfur containing ingredients in the cottage cheese, and then the high omega 3 in the flaxseed help a lot when it comes to killing cancer. So that's one of the other protocols that they use in the holistic world. Now, let me tell you something. The key of you, what I always tell to everybody, whenever you get a diagnosis of cancer, you don't just want and take a whatever the doctor tell you right away. The first thing that you do is, let's say you go to the doctor and they did a CT scan and they think you have cancer, okay, but they don't actually tell you have cancer until they do a biopsy of the place. But at the moment that you have a suspicion, okay, that you might have cancer, that's the moment that if you're not having a healthy lifestyle and a healthy diet, that's when you start the process. Your process will start by making sure you optimize your gut health, making sure you correct all the deficiencies in your body, make sure that you lower inflammation and oxidative stress, make sure that you exercise, make sure that you sleep right, do all the things, and then all the natural supplements like the black seed oil, the turmeric, okay, all the things, the vitamin C, anything that you know natural that can kill cancer, that's the time that you start taking it. Why? Because you optimizing your body just in case you need to take chemo, just in case, it might be that they kill the cancer, before you need any treatment or anything like that. But you want to make sure that you get informed before you go to the doctor, and when the doctor just throw to you whatever treatment they decide is best. You want it to be full informed, because it's sad to say, but a lot of doctors, all they want is to push in, the chemotherapy because they're making more money. So and the other treatment, they're not looking for your well-being. Another thing is that conventional treatments, they treat the cancer, they're treating the disease, they don't treat the person. They're not there to make sure that you are mentally well, spiritually well. They're not making sure that all your healthy cells stay healthy before and after chemotherapy. None of that is happening when you do conventional treatment. They're just doing what they have to do to take out the cancer as much as they can, no matter how it affect the quality of your of life for you after that. That's all that they interested on. Okay, so that's why it's important that you go informed when you're choosing an oncologist, when you're choosing a doctor. And another thing is that sometimes the oncologists, they don't have the knowledge of many of these alternative protocols and treatments that they have out there. They might don't have the knowledge. They don't have any knowledge on nutrition mostly. Remember that I told you before, and it's been said by many doctors, they don't get any nutrition courses during their curriculum. Okay, so it is important that because of that you get informed, because the most informed that you are, the better the results. Because now you not only are you helping yourself, but you're helping the doctor to be able to do the best for you, because he knows that okay, and he cannot come and throw you whatever he wants. He knows that and he cannot throw you whatever he wants. So that's why it's so important for us to be informed of what is out there before we take decisions of what to do. And it's also very important to get a second opinion if you possibly can, so that you are sure that what they say that you have is what you have, so that you can make a better decision. I always suggest people that are diagnosed with cancer to take not to only use a conventional, to use an integrative treatment where you are using the naturopathy doctor, a functional medicine, and then your regular oncologist, and all work together. If you can go to a clinic that already do the combination of both, that's the one that you want to go, because they will do everything holistic that they need to do together, and they know exactly which one and at what time they need to give it to you, which is very important, and whatnot, instead of just going to the conventional at once. And depending also on the stage of your cancer, where it's located, if you have any pain or anything like that, is also how quick you want to react. Sometimes you need to get together your mind together a little bit to make the decision, do the story, do the research to make the decision. I'm going to give you a little testimony. My husband was diagnosed with cancer last year. Okay, he was diagnosed with prostate cancer. Okay, when we received the diagnosis, the first appointment that the doctor have to be able to see him and then discuss what kind of treatment he gonna get and stuff like that was about a month and a half away from the day that we got the diagnosis. The first time that the oncologist was able to see him. In the meantime, because I'm a coach, I'm a holistic, and here we're pretty healthy. But I went even deeper, removing, going into a vegan diet with him, giving him the soursop, giving him the black seed oil, the turmeric shots, and everything that I knew, making sure that he stayed in the sun every day, that he walked, that he did exercise, do everything that he needed to do. He went to the first doctor, and the first doctor wanted to give him radiation, wanted to give him chemo, but not by IV. He wanted to give him an injection called Lupron, and then do some radiation, and then keep it, and then depending how he will react from there, whether he will get surgery or get chemo, stronger chemo later on. Okay, we decided that we wanted a second opinion. Okay, so what we did is I continued my regimen that I was doing with him. Okay, and when they did the diagnosis, my husband had 2 tumors inside the prostate. Okay, 2 tumors inside the prostate. So when we went into the second opinion, another month and a half went by, almost 2 months by the time we got the appointment, because it was a very recognized doctor in the area, and it's very busy. So when we got his appointment, he decided to do all the tests again. We start from the beginning because he wanted to get his own look of what's going on. When he did the whole test again and they did the CT scan again, my husband 2 tumors have shrunk to 1 tumor. Okay, and the tumor was located in a very centralized area of the prostate, meaning that it was not touching anywhere the edges of the prostate, so it's not going outside the prostate at all. Okay, so that means that my husband didn't have to start the injections of the little chemo that they wanted to give him. He didn't have to start the radiation because I did all that, and he went directly to surgery. They removed the prostate, they removed the tumor, and because there were nothing in the edges and nothing outside the prostate, he need more chemo. He didn't need no more radiation or anything like that. He didn't need no treatment whatsoever. I just continue to give him the regimen that I've been giving. I still continue to do it, for him now. And after that, every 3 months, he needs to do all the tests to make sure the cancer hasn't come back. And he do that every 3 months for a year, and then every 6 months, and then every year. And that we just following and he hasn't had the cancer back. He's been cancer free ever since. That tell you that natural things, if we give our body, and not only, I don't want to take the credit, that's God's credit. Okay, God did that, not me. God did that because God gave us the knowledge, give us the wisdom, give us the tools, and when we connect and we align with God, okay, then we'll be able to understand the information that we're getting and the knowledge, and we're able to use the wisdom and apply it, and that's why we get the results that we get. And of course, before we did all that, there was a lot of prayer done, and still a lot of prayer done every single day. Our prayer life is very strong in my house when it comes to that, and our relationship with God is where our King is very strong. So it's very important that for us to do that. Okay, so make sure that if you ever come to a diagnosis like that you combine both natural with conventional. And sometimes when the doctor see you, you might not need the conventional at all. You might be able to do it all with natural, and the more natural, the better. The more treatments that you can have that will strengthen the healthy cells and damage the cancer cells is the route to go. And only alternative and holistic are the ones that are able to do that for you. And if you can use the IPT, which means that it's a lot less chemo, if you need the chemo, that will even it will be even better. So I hope this information, okay, help you, and that you will do the research. Make sure that you take pictures. If you want, you make sure that you watch it again. Make sure that you share with anybody that you want to share with, okay? And make sure that if you haven't seen the first one, that is what is cancer and the risk factors, okay, and the root cause diseases, and the second one that have to do everything about the nutrition and the foods and supplements that help you combat and prevent cancer. And then this one, make sure that you can go back into the channel and see those videos and share those videos, okay? And tune in for next week, that we're going to be talking only about breast cancer. Everything about breast cancer, being that this month is breast cancer awareness. So I see you next week. Bye.